morning, Canada. Good morning, world. It's 9 o'clock, Wednesday, April 29th. I'm your reporter, Erica Cristobal. For our headlines this morning, a dental office owned by Dr. Wilson in Agassiz is bombarded with concerns coming from its new dental hygienist and few complaining clients. Let's look into it together with our reporters in the field doing their own researches. Starting up the morning report is Natalie Shine with her latest update.
Thanks, Erica. This is Natalie Shine reporting on the first concern in question. Does the X-ray and general operatory design comply with the safety code? So some background and safety information. The X-ray is a device used by oral health professionals to diagnose damage and disease that is not clinically visible. All X-rays are deemed harmful to the body, which is why radiation exposure guidelines must be strictly adhered for all operators. Dental professionals are to adhere to the ALARA concept, which stands for as low as reasonably achievable, and precautions are taken to keep X-ray doses of clients and personnel well below the allowable limits. So one of the ways to measure this radiation exposure is by use of a dosimeter, and that's a device that is worn as a whole body or extremity badge, and it is a standard method for monitoring X radiation dose. The employers that participate in this program are to ensure that it is properly managed, and all radiation findings are submitted to the National Dose Registry under Health Canada, as well as the employer. After our interview with Dr. Wilson, we came up with a couple of primary concerns. The first was the distance of the control panel to the primary radiation unit, and the second was the radiation exposure and staff precautionary measures. It was found that the general operatory design as well as the X-ray all complied with the safety code. However, the distance of the X-ray machines to the control panel was found to be 5 feet or 1.5 meters away from one another. Last, there have been no tests for radiation levels for the staff, and dosimeter tests have not been done recently. Linking our findings to research, it was found that a distance between the operator and the primary radiation beam has to be at least 3 meters. If this distance cannot be satisfied, then an adequately shielded barrier that allows the operator to observe the client is needed. The room design criteria and dosimeter usage should adhere to Safety Code 30 guidelines, which states that all dental personnel involved in the taking and processing of radiographs should wear personal dosimeters to ensure radiation exposure limits do not exceed those stated in Safety Code 30. It is important to note that under normal circumstances, there should be no radiation recorded on the dosimeter badge. Did we rule out X-ray design and protocol as one of the possible culprits for our client symptoms? Yes. It might have been one of the concerns for Dr. Wilson's dental office. However, there is no sufficient evidence to link the X-ray machine, operatory design, and the radiation protocol to support the complications that occur to the clients. That's all we have on X-rays. Back to you, Erica.
Thank you, Natalie Shine, for that great insight. Moving on to the second concern in question, what does infection control has to do with it? But first, let us know what is infection control. It is a process of preventing the spread of infection, like contaminants or microorganisms, in any healthcare setup. As the primary concern in Dr. Wilson's dental office, we look into the lunchroom, the washroom, and the dog. First, let's take a look at the lunchroom. A couple of questions comes in mind. As the dental hygiene is concerned, are the cross-contaminants, possible rodent infestation, maintenance of the lunchroom, and the water stain in the carpet. We have some questions for Dr. Wilson. He said that the clinic is being cleaned once in a week, and the staff are supposed to take turns. Linking the situation to some researches, the moldy bread suggests that spores in the mold can grow in the lungs, which can cause respiratory distress and eye irritant. The carpet maintenance is very hard to clean and disinfect, especially after blood exposure or other potential infectious materials. Carpet can harbor fungi and microorganisms. On the other side, another study said that lunchroom surfaces usually require only periodic cleaning with diluted detergents. If a surface is suspected to become contaminated with any bodily fluid, like blood or saliva, cleaning and disinfecting is necessary, but it's considered as a low-level disinfection. Under infection control, the second thing to be considered was the washroom. As the dental hygienist's primary concern, she thought that the maintenance of the washroom was a concern. When you use the vintage toilet, there's an amount of water and turbulence coming out, and where to place the belongings in the washroom. As for the conversation with Dr. Wilson, why the hook is broken, and is there any place to put the client's belongings, he just said that he doesn't know. Regarding the vintage toilet, he said that it was brought to his attention and a plumber is needed for that. The dental hygienist asked Dr. Wilson if it is cleaned regularly. He said that the cleaners only take out the garbage and clean the floors and dust it. And also, the receptionist is the one to keep it tidy. To link this information to a research, one study said that there are 52 bacterial species in outlets. It concludes the poor design and inappropriate positioning of washroom facilities may encourage bacterial contamination. It is important to frequently clean and maintain the washroom to promote safe hand hygiene practices for the public. Also, based on CDHBC infection prevention control guidelines, housekeeping surfaces have limited risk of disease transmission. Floors and walls have limited risk of disease transmission. The last concern regarding infection control is the dentist's dog, Brandy. There are a couple of concerns the dental hygienist foresee. Brandy is allowed to walk around the dental office. Dog hair might cause allergic reaction for some clients. Also, the safety of the clients are in concern. As for the conversation with Dr. Wilson, we asked if the dog is allowed to roam freely in the operatory rooms and sterilization area. He said that occasionally the dog could walk around. Nobody complained about the dog and has been at the practice for 5 months. Fur shedding is another question. Any connected allergies with the client? Dr. Wilson just said that he wasn't sure. To further investigate about this matter, there are no official policies are in place to not allow dogs in a dental office. People who have severe allergic reaction to dogs may experience symptoms soon after exposure, like itchy red and watery eyes, coughing, and even wheezing. There are also hazards and potential risks in dental clinics set up with a dog. A dog is a vector for zoonotic pathogens and human diseases. Exposure to these allergens can lead to respiratory distress, which require frequent cleaning of the dental office. There are other reasons why a dog shouldn't be in a dental office, and it is stated in my research. According to the practice standard number 10 of CDHBC, a dental hygienist must ensure specific standards for infection prevention and control. Also, the dental hygienist should comply with the infection control protocols when doing client care. Did we rule it out? Not entirely. These factors still contribute to the unsafe infection control of the dental office. It can be a substantial contributor to the main culprit that caused the infection to Dr. Wilson's clients. The client that have experienced an eye infection might be due to the contracting aerosols due to spores from the mold or animal dander. This can cause allergic conjunctivitis, which leads to eye irritation. Also, potential consequences for humans that react to canine allergens are transient rhinoconjunctivitis and respiratory problems. Few concerns are already brought up to Dr. Wilson's attention. Will these unmet standards will lead to more unopened mysteries of concern? We talked to some of Dr. Wilson's clients in practice who are all experiencing medical concerns. All are immunocompromised clients. Complaints arises to the clients experiencing eye and respiratory infections and oral lesions. We interviewed the 52-year-old Mr. Young, who happened to have type 2 diabetes and an oral lesion, and we're suspecting the cause of it are coming from the dental clinic. Let's go into the third concerning question with our in-field reporter, Danielle Lau.
Thank you, Erica Cristobal. This is Danielle Lesko reporting on the third concerning question. Does the dental hygiene operatory have proper ventilation? It is being reported that the dental hygiene operatory currently has an old rotary ceiling fan that does not appear to be moving the air in the room, resulting in stale, musty air that has an unpleasant odor. Additionally, there is an old window-mounted air conditioner that has, quote, been there forever, and seems to have rust marks that can't be cleaned off. This raises a cause for concern for the individual coming forward with a respiratory problem and eye infection, as well as the client with a history of asthma. To top it off, the hygienist herself has reported experiencing headaches. These working conditions seem to be violating WorkSafe BC, which states, the employer must establish an effective preventative maintenance program for the ventilation systems, and that a ventilation system must be designed to minimize the likelihood of exposing any worker to an air contaminant or an objectable odor. Similarly, CDHBC Infection Control Guidelines states in Part B, Section 8, under Occupational Health and Safety, that safe work practices and working conditions are a requirement. In regards to the ventilation in the room, the dental hygienist has reported that the new office uses a diluted spray called Pathix solution. The precaution on the safety data sheet states, it must be used with adequate ventilation and safety glasses, as it can cause mild irritation if inhaled and may burn if coming into contact with eyes. Further, the rusty old air conditioner may not have had its filter changed and could be harboring mold, which compromises the air quality in the room. Mold may cause eye, nose, and throat irritations, aggravate asthma and allergies, as well as contribute to the headaches experienced by the dental hygienist. It was determined after meeting with Dr. Wilson that he is confident the air quality is at safe levels and the tests are within normal limits. Additionally, as far as Dr. Wilson is aware, the ceiling fan and air conditioner are in fine working condition, and the Pathix cleaning spray solution is being used appropriately with proper ventilation and protective equipment. To conclude, there is insufficient evidence to link the headaches, respiratory problem, and eye infection to the dental hygiene's operatory air quality and ventilation conditions. Therefore, the ventilation is not the culprit of the 5 concerning issues. Now, I'll pass it over to Laura Marin.